Good evening. Your Excellencies, distinguished guests, ladies and gentlemen, I would like to welcome each and every one of you to be with us and have the time to share your insights and share your opinions with us about Merck More Than a Mother initiative. To give you an idea about the Merck More Than a Mother initiative, first I want to introduce myself. I am Rasha Kelej, Chief Social Officer of Merck Healthcare, and I will be your host today. And I would like to give you an idea about what is Merck More Than a Mother, because some of you know about it, but maybe a lot of you would like to know why we are here today. Merck More Than a Mother is a unique and the first of its kind initiative to empower an unprivileged segment of women in Africa, women who suffered infertility. They've been actually, if we be honest, neglected and mistreated and discriminated. In some cultures, women who cannot bear a child or be pregnant can actually be mistreated, disinherited, and denied access to food sometimes, to family dues, to actually be victim of violence, psychological and physical violence, pushed to suicide or killed. And this is a very severe situation. I mean, you will not believe it until you see and watch with us today the videos we are going to show you. And this is not going to be the right thing to ignore it and just let it be. That's why we created at Merck More Than a Mother initiative to say that women are more than mothers, are more than baby-making machines. Even if they suffer infertility and cannot have children, they still can be a productive member in society and can be respected and treated as a whole human being and cannot accept this kind of behavior. So we created this initiative to create a culture shift. It's very important. This initiative is very important for Africa, if I tell you why, for the reason I said, but also because in Africa, there is few numbers, it will shock you. One couple every 4 couples are infertile, which is a very high number compared to developed countries. But 85% of these infertility cases can be preventable. Can be preventable because it's due to untreated infectious diseases, which is due to many also practices, wrong practices we are advocating for, like child marriage, the infectious disease which is a result of child marriage, unsafe abortion, unsafe delivery, genital mutation, sexual transmitted diseases which cannot be detected early because it's misdiagnosed or for lack of awareness. So all this can result to complication, cause infertility. So hence the prevention and awareness about prevention is very important and can be integrated actually to the infrastructure of healthcare which already exists, like mother and child programs, HIV programs, maternal health programs which already exist in Africa. So that's why we are meeting here today to define interventions, to raise awareness about prevention, to improve access to these infertile women to information and awareness and health and change of mindset, and also to say it's okay to be, infertile. It's a condition, can be treated. There is a lot of ways to manage infertility and also can be preventable, which is high number of these cases can be preventable and cannot be even caused from the start. And also, if you are infertile, it's not the only reason of infertility is women, because in Africa and developing countries, they blame solely the women for the infertility, although 50% of the causes of infertility are due to male factors, but men in certain culture refuse to come out, refuse to take the responsibility or share the responsibility of infertility treatment with their wives, and they blame mostly only their wives for it. And this is also, we need to encourage them to acknowledge their condition and have team approach for family building. And awareness will actually help that in a very big way. So working with ministers of health, ministers of genders, ministers of education, like we have today here, parliament members, healthcare providers, societies like IFFS and others, and academia and media to raise awareness, define interventions to destigmatize infertility at large and infertile women in specific, and also support governments to define regulations and policies to regulate ART management in Africa, which is lacking at the moment, and providing education and training for embryologists. So under Merck More Than a Mother, there is two very important projects you are going to watch with us today and to have an overview what's have been achieved and what also we are planning for the future. First one is Merck Africa Embryology Training Program, which will be actually started 3 months ago and will provide training for embryologists, because many of sub-Saharan African countries, they don't have African embryologists. So they actually, patients can go outside the country to get treatment, which is very expensive if they can afford, or they bring experts from outside Africa, and also this put a lot of extra cost on the treatment. And this will be having a lot to say about this during the panel. The other one, which is very important and very emotional, is Empowering Berna project. When we met the women who suffered infertility and they share their sad experience and mistreatment and discrimination with us, it was very much for most of them too late to do anything, because they are actually, maybe they are too old to be treated, or health aspect also is not in their favor. So we find ourselves, what we're going to do with these women? The initiative and the campaign will help the future to be better. It will help to raise awareness for the future couples, for the young generation. But what about the women who is too late for them? So we said we have to empower them as well through Empowering Berna and transform them. You will watch the transformations through the videos, how these women transform from hopeless, helpless women waiting to die because there has no purpose in life, because the only purpose they've been created and been brainwashed to have is having children, and they cannot do it anymore, to an independent women. We help them to establish small little businesses so they can be a productive member in society and be independent and lead a happy and proud with themselves and have respect of society again. You'll see this transformation, and it is really overwhelming. But before all this and before we start our panel, I want to invite to the stage a woman. It's very important for this initiative and for us. She is the one who sponsored this campaign and this initiative and supported me and my team to execute and implement Merck More Than a Mother before even anyone understand what value can bring to Africa or to anywhere. So this woman is a medical doctor, and she was practicing medicine before joining the pharma industry. Please join me welcoming Dr. Belen Garijo, the CEO of Merck Healthcare and executive member of the executive board of Merck, and the first woman to be member of executive board of Merck.
Thank you, Rasha. How are you?
Thank you.
Good afternoon, or good evening almost. Very pleased to be here.
Thank you.
You will sit?
We can sit and we can first talk to them, and I want to ask you and to share your view about a very important question. Why, you told me before that Merck More Than a Mother is a very important initiative for you and your favorite, and you think it's very unique. Why do you think Merck More Than a Mother is a unique initiative, and why did you strongly support it from the start, even before anyone inside or outside the company understand what value can it bring to African women?
Well, first of all, let me welcome everybody here in the room. As Rasha mentioned, this is a very, very important day for all of us, because we are further expanding the news on something that I believe is a unique campaign. She called it campaign, I call it initiative. Doesn't make too much of a difference. This is one of the most important programs that we have in the company today. And yes, it is very close to my heart. It is very close to my heart, not only as the CEO of Merck Healthcare, but also to a certain extent as a physician and as a woman. Why is this the case? First of all, because Merck is a well-known leader in fertility, and we have been in business for more than 20 years. We take pride of having developed and commercialized drugs that really changed perspective for couples that wanted to have a family and were confronted with infertility. So we have done so for 20 years, and most recently, our strategy has gone from focusing exclusively on developing pharmaceuticals to offering a broader support to these patients and these families that has the dream of having a child. I believe this initiative, the More Than a Mother initiative, truly illustrates, first of all, our new strategy, so serving the patients in a holistic way, but most importantly, this initiative is actually bringing us back every day through each and every step we make, is bringing us back to the very heart of our mission. We help create life through everything we do around fertility. So this is why sponsoring and being behind this initiative, supporting the team, and Rasha in particular, who was the one that proposed this to us, is really extremely rewarding for me. You know, each and every day we think, how do we take it further? We have started this initiative in Africa. So I have the privilege to kick this off a year ago with some people who are in the room with us today in Kenya. And it is all about generating an environment which is helping these women understand what is happening to them, what are the consequences of what is happening to them, how can they better address the challenge, and how can we prepare the society and create an environment which is helping address the social suffering of these women. This is what it's all about. And during this kickoff meeting, I really discovered a new world. We believe we are multicultural, and we believe we have seen almost everything. When we work in healthcare, in chronic diseases, we work with cancer patients, with multiple sclerosis patients who suffer a lot. You believe you have seen it all. And we also live in countries which are, or we believe we live in countries which are developed versus developing countries which obviously have a different problems. When I was there in the audience, I was discovering a new world. A world in which simply because females cannot build a family together with their husbands, they are completely ostracized, they are rejected by their families, they are actually kicked out of their homes, and they really live in a world which is extremely hostile to them. So from that day on, we decided to take this to each and every corner to make sure that we create this cultural shift which is so necessary so the world understands that this is happening. And you know, More Than a Mother actually created a frame in which for the first time this was brought to discussion, to debate. So the white elephant in the room was being discussed. And simply by discussing in a cross-stakeholder manner the problem, we will be able to find solutions. This is something that obviously will not be fixed by a single segment, by the industry or by the stakeholders. This has to be this has to be solved through a constructive debate in which we generate additional awareness of what is going on and what are the potential options to these women. So cultural shift, awareness, importantly training, capability building. So once the problems are identified, this can be dealt with. Fourth, making sure that we have a regulatory frame which is actually actively dealing with the issues. And last but not least, providing access to whatever is existing today. So More Than a Mother is still very, very close to my heart. Yes, one of my favorite initiatives. This picture is in my office. It's the biggest picture I have in my office because each and every time I look at this, it reminds me of the responsibility that we have as a company to continue to take this initiative much further. Today we are in Africa, but I believe, and we were having this discussion before we started the panel, I believe we can take this frame much further, and I dream of a time in which this becomes extremely strategic for us and is allowing us to customize this frame to other societies in which we still have to progress one way or the other in the area of infertility. And this is not only Africa, this is China, we mentioned China, and why not helping us dealing with the disparities that we have even in European countries, the access disparities. So it's very critical for us. The whole executive board, which I represent here, the Merck family, the owners of our company, are extremely committed behind this, and we are very grateful for all of you being here with us, helping us further shape this to make a higher impact to society and to the patients suffering from infertility.
Thank you very much, Belen. Thank you very, very much.
Thank you.
This is great. So I think we will start our panel now, so if you would like to have a seat,
Thank you.
I will call
Yes.
the guests. So we'll start now the panel, and I will call my distinguished guests, and I will start with Her Excellency Minister of Health of Uganda, Honorable Sarah Opendi. Please join us in the panel. Her Excellency Betty Amongi, Minister of Lands, Housing and Urban Development and Chairperson of Ugandan Women Parliamentarian. Please join us. His Excellency Senator Dr. Larni Tujus, Chairman, Senate Committee on Health, Nigeria. Please. If you want to jump. Yes, please. Honorable Joyce Lay, Member of Parliament of Kenya and also Kenya Ambassador for Merck More Than a Mother. Please. Professor Joe Simpson, President of International Federation of Fertility Society, IFFS. Yes. Professor Prof.Ashiru, President of Africa Fertility Society. Please. And Dr. James Olalobo, the Vice President of Africa Fertility Society from Uganda. Thank you. Dr. Ivan Sainai, Director of Indonesian Reproductive Science Institution, IRIS. Please join us. And my dear colleague, Dr. Karim Bendaou, President of North and West Africa, Merck. So we will settle down first. I think we have a very important high-level panel today to discuss and to define different intervention and share their insights, and you share with us also your suggestions and your insights. Now you know how the severity of the issue can reach, and why we are here today to try to solve this and try to find a way to empower these women, which is we are in the 21st century and we still have women suffering this way, which is should not be the case, because women are more than a mother. So my first question will go now to Her Excellency Honorable Sarah Opendi, Minister of Health of Uganda, and also Ambassador of Merck More Than a Mother of Uganda. We kicked off the initiative in Uganda together, and we also have cases we help to empower different women who suffered infertility and there has no way to have children anymore. And you also have your plans and strategy to regulate the ART and to define some interventions to empower these women. Can you share this with us?
Thank you very much, Rasha. I bring greetings to you from Uganda, the Pearl of Africa. I really want to thank Mark for tackling a subject that we all know has existed for a very long time, but had never been brought to the public domain. And when we launched this campaign in Uganda, it was everybody was talking about it, and we all acknowledged that infertility has existed, but unfortunately, it remained an individual's problem. It remained a problem affecting an individual at the community level. And so, of course, as a country, we know that of all the couples attempting to have a child, between 10 to 15% fail to have a child. And of course, you all know how distressing it can be for a couple to attempt to have children and then they cannot have the child. So, of course, as a country, we have services available to help infertile women, but this is limited within the capital city in Kampala. And of course, we have just about 5 clinics available, but very expensive, that only those who are educated and only those who have the resources can actually go and get the services. And of course, in the countryside, if you move to the village, those women who are infertile do not know that their situation can actually be corrected for some of them. And others believe it is a curse. Others believe they have been bewitched. And so they live in that kind of state. So from the time we launched this campaign, we as a country, we as Ministry of Health are trying as much as possible to integrate fertility care services into the already existing healthcare services that we have. Of course, we have been focusing much more. When we talk about reproductive health as a country, we have all been talking about reducing maternal mortality and promoting contraceptives, but no one has been talking about this infertility and how to prevent infertility. So it's one of the things we are trying to now integrate into the already existing reproductive health care services. And this, of course, will be at no cost because as a country, we have primary health care services provided free of charge to the population. And of course, when the mothers go to the health facility, it's not only talking about family planning and contraceptive use, but also talking about infertility and how to prevent infertility. So this is one of the things that we are doing, but also most importantly, we do not have any existing regulation, and this is what we are trying to work on now, to have the ART/IVF regulation in place. And we hope that maybe within the next 2 or 3 months, we should be able to conclude this in our country. Thank you very much.
This is great. Thank you very much. Thank you very much. My next question will go to Honorable Joyce Lay. She's a parliament member of Kenya, and she's also Merck More Than a Mother ambassador for Kenya. We kicked off, as Belen said, with Belen Garijo, our CEO, the initiative with her in Kenya. And she will share with you, but after we watch her video, because she has also a story to share with you about her experience with infertility and surrogacy, and why she started to sponsor the ART policy and bill in the parliament.
Thank you very much, Rasha, and thank you, everyone. As a woman, when you don't have a baby of your own, the pain is immense. I mean, looking at Grace's video, it doesn't matter what stage you are at in life, it doesn't matter what age, you still feel that pain. And since the law is not in place in most of African countries, we had to make sure that we have that law to regulate ART in Kenya. And as we speak right now, I think we are the first country, is it in the whole of Africa, right? Sub-Saharan Africa, to have brought the ART bill in the House. And right now it has been passed at the National Assembly, it has been taken to the Senate. And then from the Senate now, it comes back. If there are no amendments, then the president assents on it and it becomes law. As you can see from the video, when I got my son, because we didn't have the law into place, I had to go through adoption.
Surrogacy.
Yes, because I had to, I use a surrogate mother, and because we don't have that law that governs surrogacy, I had to go through adoption to adopt my own son. And it was a long process. It took almost 4 years because to them it was a new thing. Not that IVF does not happen in the country, yes it does. Not that people don't seek surrogacy services, yes they do. But then how do they get the documents? And as a leader, I had to take the long legal way because nobody saw me pregnant, so I cannot go around telling people, this is my baby, where did you get the baby from? So I started telling my story. And it was easy for me to reach people because I had that platform of leadership. And it was also encouraging to other women to hear my story and say, she's at that position, high-level position, but yet she went through the same pain that we are going through. She went through the same tears that we're going through. So it was easy for me to reach out to other women. When they listened to my story, they got encouraged. And then I promised them once we get to Parliament, we'll make sure that we change the law. So I agreed to use that long process of adopting my own son in order for me to get there and change the process and the law for any other woman or any other couple that will be going through the same thing. And I thank God because of the Merck More Than a Mother campaign, because we created more conversations on social media. We had social media, we were trending for almost a whole year. And people started coming out to discuss about infertility. Even men started coming out to discuss about this openly. Because like my colleague has said, in Africa, it's like a curse, it's a taboo. So you're not allowed to speak it out. They speak in harsh tones. And most of these women, they hide because nobody wants them in the society. They feel like nobody cares. And then as much as it is a shared responsibility, the woman most of the time is the one who carries the shame, carries the pain. She's the one who carries all the tears and embarrassment because men don't want to come out and talk about it. To them, maybe it's a sign of weakness just to admit that maybe I'm the one who has a problem. Maybe we should go to the clinic and so that we get checked. We have stories of women who got married and they had to go through divorce just because they could not have children. And when they went ahead to get married again, they'll have children. So the problem is not just women. That's why we're talking about it, to make sure that we fight the stigma. We fight that because it's not just for women. And this media campaign and the More Than a Mother campaign has really helped. Recently, I had a woman with her husband coming to me to talk about their problem. And even some members of parliament, also male members of parliament, they will follow us after a session and say, yes, we also have a problem. But how can we talk? Because other men will start laughing at us. It is not a laughing matter. And that's why we're encouraging all governments to try and make sure that they incorporate it in the health budget, because most of the time it's left to you to decide what you're going to do to deal with your own problem, and even there's no budget in the ministry to handle that. I remember when we started the campaign, even some of the members of parliament did not want to be associated with this campaign. They said, we are trying to reduce, we're trying to advocate for family planning. So how can we talk about family planning if you want us to talk also about infertility? But you see, it is against human rights, because when you talk about family planning, we're talking about having one child or two in every family. But what about a family that cannot have a child? You cannot say, yeah, it's good for you, you can't have a child because we have so many kids, we want to reduce kids. No, we have to make sure that we help them. And this campaign, we are educating people on early detection, early prevention, because most of the cases can be treated before even they cause infertility in their bodies. So there's lack of education, lack of information, and we're using this platform to make sure that we reach out to everybody who wants to hear this message. Thank you.
Thank you very much. Thank you. I actually remember when we discussed and we said about 85% of the infertility cases can be preventable. It was a shocking number for many people, and they said, this is actually can solve the problem in no time if we increase the prevention, because prevention campaigns proven its efficiency in fighting many diseases. So before, I mean, we have received also on the social media, like you say, a lot of people asking about what happened to Grace. Yes. I mean, Grace sharing her experience and sadness and misery, and she's crying in the video. So what you have done to help her, because we cannot actually help her to be treated because it's too late for her. She's older now. And there is other women, not only Grace. If you go to our social media, Merck More Than a Mother, you will see on YouTube another women, El Shiba and Berna and many other women. We cannot share all their stories with you now, but specifically Grace, because she was the first woman who shared her experience with us. So I will show you now how and what happened to Grace after meeting Merck More Than a Mother, and after initiating and rolled out Berna, Empowering Berna project, to establish a small business for her. I want you to see the transformation. Which transformation happened in 1 week. Belen, my question will go to you now. What do you think about Empowering Berna project, and what is your first feeling when I shared with you the first story of these women who've been empowered by Merck More Than a Mother?
Well, I think the story is extremely moving. Each and every story we show illustrates the point that we discussed before. Each and every testimonial of this woman is actually inviting us to continue, to expand, to do more. I think we live in a world of empowered patients. We all want to make decisions for our health, and this is happening every day. So at the end, empowering these women to make their own decisions has a lot to do with us. I think Grace mentioned that in the video. She says, if I had known this before, if I was younger, probably I would do things in a different way. So I think education, awareness, the regulatory environment this is what it's all about. Yes. So feeling that you contribute to that, and that as a company we have created so much momentum in certain countries about this, is extremely rewarding for us. And it should be inviting us to do this, to do more, with the same level of energy and passion that we put every day in fulfilling the expectations of what we call our mission. As I mentioned before, help create life, in this case, through better informing patients on their options, to making this a human rights topic. So each and every person that has to, each and every stakeholder that has to do with this is aware of what is their role in helping create something much better for the society.
Exactly, I agree with you that all these women, we reach them through the ministries of health and parliaments and all our guests here, because without them we will never know where they are, and they helped us even to discuss their cases and to see what exactly we need to do. So without our partners, we will never be able to achieve anything.
I think this point is very important, Rasha, because here we have representatives of the industry, different governments, very senior officers, patient associations, healthcare professionals and industry and physicians associations, and is through the great cross stakeholder collaboration that we will go faster and we will have a much higher impact together. So I believe also some global health organizations should be making this a priority, and we have learned today through one of our colleagues in the panel that WHO is putting this topic in their priority list, and this is a very, very important step. So each and everything we can do to continue to engage other stakeholders is going to pay off.
Yes, great. Thank you very, very much. Honorable Betty Amongi, Her Excellency Minister of Lands and Housing and Urban Development. And before that, because we have to congratulate her today because she just got the ministry 1 month ago. And before that, so congratulations. Before that, she still is a chairwoman of the Ugandan Women Parliamentarian Association. And as a parliament member, what do you think, how to improve access to regulated fertility care and change the social perception? And we discussed yesterday how we will try to empower women in Uganda the same way like we did with Grace. As also your new position as a minister, you talked about changing some laws to empower women for their inheritance, which is different in Africa, so we can share this knowledge with the guests.
Thank you very much. I think one of the key issue is that the campaign is dubbed Changing, or Together We Can Create a Culture Shift. The issue of infertility is embedded in culture. The consequences of those cultural rules and cultural values are what you see from Grace and what you hear from our colleague Joyce. One of the key issues is that the cultural aspect in most African countries is that you inherit the wealth of most Africans are embedded in land and property. And so culturally, a girl child or a woman inherits from where she's married. And when you are married, you are expected to give children in the place where you're married. So in Africa, when you don't give birth to a child, culturally, you are supposed to go back to your home. And that is the story you saw from Grace, where she stated she was married. When she could not have the child, the husband told her to go back. And when she couldn't go back, she had to look for another opportunity. And when you go back where you are born after you got married, you are not even allowed to inherit any property or land from where you're born, because your brothers and the children of the brothers are the one entitled to heir it. So you can see that there is no space for an infertile woman or girl in society culturally. And yet for an infertile man, the culture permits the man to even use the wife of a brother or any other
girl to give birth and she will remain and inherit land and property. So that is how bad it is. So the consequences that comes with being infertile as a woman and a girl leads to, 1, economic exclusion in society. 2, lack of ownership of property. So you are rendered hopeless. Now, as a parliamentarians, we are the voice of the people. We are supposed to be the one to answer the hard questions. So when Mark More Than a Mother came to Uganda to launch this, as the chairperson of the Women's Caucus in Parliament of Uganda, we have 35% of the membership of Parliament being women. So we organize ourselves and get our leadership. So I chair the Women's Caucus. So I said, no, we must ensure that first we handle prevention. And how do you handle prevention? As parliamentarians, our roles are to make laws. Our roles are to appropriate money in the budget. And we realize that prevention requires primary health care, ensuring that hospitals are in villages. Because if there were a good hospital in the villages, a person like Grace would have been able to go to the hospital and to be helped. As we speak now, most of the IVF centers are in urban centers. Very expensive, even for a person like me, it will be very difficult. I might have to, if I cannot give birth, I will need about $10,000 for me to be able to go through the process of Joyce for surrogate, or to even remove my eggs and the sperm to fertilize. It will be a minimum of about $10,000. So the way you saw Grace, would Grace afford? I don't know how she afforded if she was not a member of parliament, because majority, over 80% of people cannot. So as most important for us as leaders is to ensure that we appropriate budget for health care, so that, 1, we can have the infrastructure for health accessible to the poor people. We should have the human resource for health that can work to prevent infertility, to prevent STD, to prevent all those diseases that can lead to infertility. The issue of law to regulate the functioning of infertility, to ensure that we have clinics at the primary health care level, is very important to me as a parliamentarian. But with the new responsibility also as a minister now, we have a law on land. I told you land constitutes about over 80% of the wealth in our countries. It is a prestige, it is economic asset. You cannot get mortgage without land. Most of the mortgage, you have to tender security of land to get mortgage from the bank. So what we have put in the law is equality, and ensuring that women, when a man goes to, for example, a father goes to get a loan and uses security of land, that all the children, irrespective of whether they are girls or boys, they should have a say. And we are now moving into the aspect of equality where women and girls can inherit from where they are born, so that we can stop the culture of women having nowhere where they belong. Because a woman now can choose whether to get married or not. If we do not have a clear law to say women can inherit land where they are born, then every woman will struggle to ensure that they get married even when they don't want to. A woman who is infertile will have to force herself to look for where to belong. So that is where we are looking at. But also what you have seen, some of you might have, in the context of the developed world, you could have seen that Grace's transformation was minimal. But in the rural African context, you put $500 to a person who is hopeless and helpless, that has saved her entire life. The project that Mark gave to Grace has changed her life. You could see her smile. It could have been just $500 or $1,000. And so we are working with Rasha to see that where I come from in my constituency, next time when we go to New Delhi, we have more women like Grace who can get support through this campaign, so that we use it to not only make Merck be the one to champion. Would love to hear some of you in the field come to her to say, we love this idea, we shall come and support Merck. With that, I want to thank Rasha for the great work she's doing. It is not easy, and therefore, Doctor, we hope that you will look at Rasha as an asset for us who are driving this campaign, and we hope that you give her much more responsibility to come to Africa and do much more. Thank you very much.
Thank you. You're advocating for me now. Thank you very, very, very much. I'm really grateful for all this. I want to now ask Dr. Larney, Chair Senate of Committee on Health in Nigeria. He is also our ambassador for Merck More Than a Mother in Nigeria. And as you see, we have all the ambassadors women, and this is the first time we will have a man as an ambassador for Merck More Than a Mother. I feel that this is going to add really great value as well, because new perspective as a man in power. He is a very high position and decision maker in Nigeria. He can actually, with a small signature, change also the law and the regulation to regulate ART in Nigeria and empower all the infertile women there. And he actually very active, because even yesterday we talked and he said, look, Rasha, you have all this list of women. I will call them myself one by one to make sure that they are really need this and they are really in the right choice, because we need to be credible, and this campaign, if I put my name in it, it has to be very successful. So I would like to invite Dr. Larney to talk about this and to share his view how we will support Merck More Than a Mother in Nigeria.
Thank you very much, Rasha. I am very, very grateful on behalf of Nigeria to Merck, because what Merck is doing for Nigeria by this initiative is very, very huge when you compare the population of Nigeria. Nigeria is the most populous country in Africa. We have a population of about 170 million people. And when you consider the fact that 1 in 4 of the population is supposed to be infertile, so we are saying we have about 40 million infertile people in Nigeria, which, I mean, is a wake-up call really for even me as a medical practitioner, because if not for this Merck initiative, I wouldn't have put much attention to infertility like that. So I congratulate Merck for this God-sent initiative. In Nigeria, it's a very peculiar situation, because Nigerians are very religious people. We have the largest church in the world. We have a church that every service, we have about 2 million people at a service. So you just have to come there to see. It's like a city, a religious city. And when the head of the church calls for people that are having challenges with children and are looking for the fruit of the womb, they should come up for prayers. Now, about 25% of the church will be up and they'll be running to the front. Both couples and maybe more women than men, which confirms what we're saying, that the men believe the woman is the problem. With this Merck initiative, I, as a parliamentarian, I want to make sure that now our campaign will go to these churches and even the mosques, that when they run for prayers for infertility, we are going to ensure that the pastor will tell them to go to screening points, because that is really what the pastor needs to do first. It's after the screening point does not disclose any ailment or any problem that then we can now ask God to help them. In Nigeria, we have HIV, malaria, polio, tuberculosis as the major diseases that we are focusing on. But I'm challenged now because infertility seems to even have more prevalence than some of these diseases. And I believe the reason why we are focusing more on these diseases is because of our development partners. For example, HIV, we have a lot of support from the international community, and they enforce that we must have our counterpart funding. So we parliamentarians, the government, ensure that every year we contribute a percentage, because without the percentage, we won't have the contribution from the international community. So I believe infertility too should be in this category. If Merck, for example, will now say, okay, Nigeria, we are going to contribute $100,000 every year towards infertility if you can also put down $25,000. Then we are going to put infertility in the front burner in the country. Then we are going to have more advocacy because, I mean, once it's in the budget, we are going to appropriate the budget, and we definitely must ensure that screening points must be all over the country. In the country of 170 million people, you can imagine how many screening points we will need. In Nigeria, we've had challenges with primary health care. We do not have functional primary health centers. This new government, as a kind of emergency, is that it's going to introduce 10,000 primary health centers in the country over the next 2 years. The primary health centers have been designed, but before now, the issue of having screening centers for infertility was not included. Thanks to Merck, I'm going to ensure that at least a reasonable percentage of the centers will have screening centers for infertility. And the budget for 2017, because this year's budget has already gone, the budget for 2017 will definitely include provision for the screening centers. We are looking forward to Merck coming to Nigeria in September.
Yes.
September 27, when I will dress like a woman, since I'm the only female or male ambassador.
Yes.
So I'm really looking forward to that. But before then, I hope to have introduced the ART bill to make sure Kenya is not the only popular country in Africa that has introduced the bill successfully. We would have advanced a bit before you come in September, by God's grace.
Very good. It's great.
And the issue has been played down so much in Nigeria that, I mean, the issue of infertility, if not for the Prof.Ashiru, who is known as Mr. Infertility in Nigeria, I believe it's his face that has made infertility even come out a bit in Nigeria because of his initiative and his private sector contribution to infertility solutions in Nigeria. We are very excited about the September introduction, and I can assure you that once we take off in September, infertility would overtake HIV, malaria, and so on in Nigeria.
Thank you very much.
So I thank you very much for the attention.
Thank you very, very, very much.
Well, I was just told that Nigerians can dramatize. So, and we are very joyful people. They say we are the happiest people in the world. And you can see that's the way we dance in the church. Yes. Confirming my story on the church. Yes. Once again, I thank Merck for this opportunity in Nigeria coming up. And also, in addition to this initiative, which I discussed with Rasha yesterday, I said that because of the economic situation of the world, not only Nigeria, we should also try to devise a way that we attract the men to come for screening by also putting a kind of award for men that come with their wives to come and screen to confirm who has the challenge. And I believe Rasha will take this forward and will come up with something that is mutually beneficial to everybody. So I believe us once again to congratulate Merck for this initiative. Thank you.
Thank you very much. Thank you. Thank you very much. Professor Joe Simpson, the President of International Federation of Fertility Societies. With your long experience in fertility management and your position as a President of IFFS, how do you see IFFS collaboration with Merck More Than a Mother to improve policies to regulate fertility care and building capacity through providing trainings? And how do you see also your contribution to the intervention of destigmatizing infertility at large and infertile women in Africa and developing countries in specific?
Thank you. It's a pleasure to be here. This is really an exciting panel. I've seen some poignant videos that I will never forget. I can absolutely promise you that. And there are a lot of people to thank. I'd like to thank, first of all, James and Oladapa, our good friends and colleagues through the International Federation of Fertility Societies, who are valued members of our organization and have pointed us in many directions, including the one that we're in right now. I'd like to thank Belen in particular for recognizing the value and having the receptors to follow this forward. As we have already talked, it's easy to have a call to action, to make a speech and expect things to get done. But it doesn't happen easily, and I think Belen and Merck have shown us the way to do it, and we've also seen transformative women, parliamentarians, who have taken it to the next step. So it really takes all three of these: a recognition, someone to fuel it, and also the people that follow through on the details. And Rasha has been fabulous. And yes, Betty, when she stands up, I'm worried that she's going to fall as well. You're not the only one. But we can assure you that there are several able-bodied men who are willing to try to catch her if this occurs. So, but to the question, the International Federation of Fertility Societies really is interested in each of these areas. We don't address a problem until we know what a problem is, to begin with. And one of the things that's occurred in our organization for over 2 decades is a surveillance program that looks at not just the success rate, of which there are several around the world, but it looks at rules, regulation, guidelines, laws, what prevents it, and what prevents successful fertility therapy. And Stephen Ori is the leader of this group. Steve, could you just wave your hand so people could come up and see you? And Steve has surveyed over 70 countries worldwide to look at all aspects: what is available, what's the guidelines, and what's legal in terms of doing this. So this is really the first step in terms of recognizing this as a problem. And this is done as our deliverable to the World Health Organization, of which we, like 3 other fertility organizations, are non-governmental organization, NGOs. And the significant area in which we think this works is it allows one country to look at what happens in another country. So if you say that we cannot afford this particular treatment, or this law is against our culture, our member societies, of which we have about 70, simply can look and say, well, the next door neighbor does this, and they have a similar culture, they have a similar economic basis, and therefore they're able to do that. Another area in which the International Federation of Fertility Societies interacts and is synergistic with your program is through our workshops. And we have workshops and sophisticated meetings. So this is a sophisticated meeting at ESRI. We have one coming up in just 2 months, our Triennial Congress in New Delhi, in which participation of this, what we're seeing here, Merck, More Than a Mother, will be there, and we will have to talk about that even more after hearing what I have heard tonight. But we also have that's a sophisticated panel in which we're pointing out the other aspects, the implementation and interventions that we have. But we have other areas in which it's basic training. We have programs in which we go into developing parts of the world and we point at basic infertility. What is the infertility workup that any physician or any health provider, doesn't have to be a physician, is able to do? And how does one do a sperm analysis? Because how does one know that a male is infertile? You have to have easy access in order to do that. And those are areas that we look at. The advocacy and how we avoid the stigmatization that occurs, really, the parliamentarians here have told us how to do that. You have to tell the public that there's a problem, and you have to tell the public that there are things that you could do about it. Imagine the stigmatization in Africa for the first few years of HIV, and I'm not so naive as to think some of that does not still exist, but it's centuries away from what it was in the 1980s and the year 2000. So HIV is a chronic disease now, like asthma or diabetes, and it's treated with the same area. It's looked upon the same way because it's treatable. And our advocacy ultimately comes through our work with the World Health Organization because there are no more effective advocates than the ministers of health. There's no way, except for the voters in the individual country, to knock on the door of the ministers of health and get them to pay attention. When WHO in Geneva calls, you cannot fail to pick up the phone. Doesn't mean you'll have success the next day, but you will do it. So I hope that helps.
Yes.
We're in it for the long haul. We are greatly appreciative of what you've done in starting, and that is truly impressive. The world is paying attention, and keep doing it, and we will help you do that.
Thank you very much. Thank you. Thank you very, very much. Professor Ashiru, the President of Africa Fertility Society. I would like to thank you in front of everyone because you've been great support to Merck More Than a Mother from the start of attending Uganda kickoff. And we are now preparing together the kickoff of Merck More Than a Mother in Nigeria. And the accessibility to all your platforms and the whole healthcare providers across Nigeria, which there are too many. I mean, knowing that it's 200 and something million population country. So, can you give us an idea about infertility in Africa and the different challenges that happen for or associated with infertility in developing countries and in Africa specific? And what is the expected outcome you have from Merck More Than a Mother launch in Nigeria?
Thank you very much, Rasha. First of all, I must thank Dr. Belen for your support to Rasha. I had the opportunity also of meeting the chairman of the Merck family in Cairo, and he too is as enthusiastic as you are. Rasha is very energetic. In fact, in my house, when the phone rings at about 8 p.m., they know it's Rasha because she's talking about, have you seen Professor Simpson? Have you seen the minister? Have you? So, and I'm happy that today the president of the Nigerian Fertility Society is here with his vice president in preparation for the for the launch that we will have in Nigeria. I equally made sure that the chairman of the Senate Committee on Health, who happened to be my student many years ago, is here to support this initiative. The minister should have been here, but as I said, there was the doctors are having a strike in Nigeria. I have brought to African Fertility Society over 36 years of experience in research and clinical work in infertility and in IVF. In Africa, my pain, which led me to create a magazine called Health Awareness, was that many patients come to that clinic, and if you see the women, the level of torture they have experienced, laparoscopy, endoscopy, all the scopes have been done. All the HSN, hysterosonography has been done. And when you look at the man for the first time, there's no sperm. And you wonder, why was this woman being subjected to all this level of intervention? And at the end of the day, by the time you are looking at this woman, those interventions have created problem on her, such as damaged blood tubes and endometriosis from infection. So that has made me to realize that with the advent of in vitro fertilization, which we are the first to pioneer in Nigeria, with advancing technology, some of these patients were still not getting pregnant. So the peculiarity for Nigeria is, first of all, awareness and education. Education to prevent sexually transmitted disease. Education to prevent the nutritional toxins that can lead to some of these things like fibroid, or that can cause some environmental, some damage to the reproductive organs. We are an oil-producing country. Some of our oil-producing areas, most of the men that come from this area have severely low sperm. And when you do bioenergetics on them, you find that they have oil fossils. And some of them became pregnant by detoxifying, just like that, without anything again. Even those that you thought had low ovarian reserve. So, my focus is, one, and I always tell the man, anybody that comes to the clinic with the wife and the husband, their chances of conception is higher. But in Nigeria, men don't believe that they are infertile. They believe that as long as they can carry out sexual intercourse, and as long as sperm is coming out, they are fertile. So they tell the woman to go to the clinic and solve the problem, that they are okay. And men will come to my clinic and refuse to do sperm analysis. I say, they don't want to do it. And you say, why? Because I'm okay. And you ask, how do you think you are okay? Because I just know I'm okay. And when you tell them that, oh, this is the problem, then they tell you, as the minister said from the church, they reject it. Somebody has fibroid, and you say you need to remove this fibroid. He will say, no, I don't have fibroid. I reject it. Like by rejecting it, the disease is not going to be there. So we think that men and women togetherness should come to a clinic, and screening should be the first line. But not just that, health education right from school, so that people to know that the minute they're having discharges, either in the urethra or in those areas, they should seek a consultation. And we must, in Nigeria, put emphasis on the environment. People who work in the paint industries, in the petrochemical industry, they don't have protective gear that causes damage to the sperm. And so this intervention campaign in Nigeria is going to be very, very worthwhile. And for Africa, because of this help from Merck, which has now made it a major focus of objective for the African Fertility Society, we are getting on board each of the countries that practice infertility, getting their doctors to form associations. Now we've got it done in Kenya, we are doing it in Ghana, and in India, in Uganda, and also in India, the Lome people will be coming to participate in this function. So I think overall, within the next 5 years, I imagine that the whole of Africa will have been properly covered by this initiative. And once again, I thank you, and I hope we are on the right track.
Dr. Ivan would like to share your experience about this training with the audience.
Yeah, first when I was invited to Kenya about a year ago, same sort of perspective that I had, where I was struck to the fact that high infertility was really quite of much worse than what we had when I started the IVF program about 10 years ago in Jakarta. We see so much of similarity in developing world, particularly when we are talking about the stigmatization of infertility towards women. And when we had this discussion about how much we want to be involved, particularly we're doing a reasonably busy center, about 2,000 cycles per year in our unit. And we have been training our human resources on our own all this time. But given the challenge that was given, I thought I didn't have too much time to think, because this would be a very, very exciting moment for African society. Because, of course, when we're looking at infertility treatment in developing countries can be very different, particularly when we are managing patients with a different perception and also different environment to the developed world. And I see that the government, from the government viewpoint, that what you point out about previously infertility and infertility management and population management is completely different. And that's why we need to address that infertility management, to address properly. And it comes down to how much of regulation put into it. And I believe that Africa is in a very, very ideal situation, compared to my country had, because at the moment the regulation towards the human resources is not yet that valid. And we have been establishing our program for the last 20 years or so now. So coming down to the human resources, it all comes down to whether the availability of the embryologist and the specialist are there. Because if you don't have the specialist, you don't have the embryologist qualified enough to be able to provide good quality services, then there's no way of infertility management will be done properly. So when these two embryologists came over from Africa, I first asked them what their intention was, and then how much of a passion that they had. I saw right in the very beginning that this would be a very brilliant start for them to be part of this initiative. So after 3 months of engaging themselves with very minimal clinical exposures to IVF activities, of course, having being exposed to a high volume of activities allow them to be able to do and reach the possibility for them to be able to do procedures like most of the senior personnel in the laboratories, and that really gives me more faith that they will be able to return to Africa. And it is much more important, when I told them before they return, is you need to make sure that you need to find patients, because at the moment it will be simply just a training program without a continuation. And I think with all of these panelists that we're sitting here, I believe Africa will move forward. So congratulations. Thank you.
Thank you very, very much, Dr. Ivan. We are really grateful also for this opportunity, because we know that giving 3 months of your time to train candidates, it is too much difficult, because we couldn't find actually, I mean, someone on your level of experience and knowledge be able to dedicate this long distance, this long period of your time and your busy agenda. Thank you very, very, very much. I would like also to acknowledge and thank very much the executive board of IFFS and of IFFS officer to being here with us, and really we are happy that you are joining us, and we will have time after, of course, for interaction and to deliberate more about the topic. My question, I have 2 questions. One for Dr. Karim Bendaou, the president of North and West Africa, Merck Healthcare. I would like to see, what do you think really, Karim, about this initiative, and how this will fit with the strategies of Africa and the implementation of African business in your region?
Thank you very much, Rasha. So, Rasha, indeed, this program is an amazing program, because it's really reflecting what I lived the 15 past year. I mean, I live this every single day, and this also will a bit energize myself and my team to speed up in finding solutions. You know, we are working now on some keys, some key solution is really to train and employ community-based health officer. You know, in Africa we have this health officer everywhere. These people will provide essential primary care at the village level, and we are also trying to speed up the last setup of our mobile phone-based telemedicine, which is a kind of digitalization, as you know. This will connect health officer and a rural patient with a specialist, and in the cities, or a specialist even in Indonesiaa, even, if you like, if you still have some time. Yeah, and we'll include this in the a project very close to my heart, which is the Merck Rural Pharmacy. So we'll have now a section fully digitalized, connected to expert centers, which can help the population. So that's in a nutshell what you are there. Thank you.
Dr. James, Vice President of Africa Fertility Society, what do you think about the embryology training? I know that you were engaged with me in selection criteria of all embryologist candidates, and you are also involved in a research will be out soon. So can you give us an idea about, first of all, how this training program is different than all the training attempts happened in Africa before, in 5 minutes?
Yes, Rasha, thank you, first of all, for having me in the panel. And may I also thank the distinguished audience this evening. I would focus mainly on embryology training, but there is first an editorial to it, that it's really a collaboration. It's bringing people together to share experience and knowledge. And there are structures there, like the African Fertility Society and the national societies, which are being formed down to the clinic level, which will empower all these systems we are working on. And it must also be recognized that we are working in the context of clinical services, preventive services, and also dealing with the cultural and social aspects. So when we now focus clearly on embryology, which you have seen from the video and the Dr. Sini's presentation, I want to capture 1 or 2 key things on embryology. First, that embryologists are the unsung heroes of assisted reproductive technology. They hardly come in contact with the patients, but they are working in the powerhouse. That is the laboratory, dealing with the gametes, the sperm and the egg, and the embryo. And it is from their output that the IVF doctor is able to transfer the good quality embryos into the womb. So basically, they are the powerhouse and provide the technical and the scientific support during ART. So one would immediately ask the question that how is it possible that this particular human resource has been picked as a key component of Merck's More Than a Mother program? And the story all emanates from two things. That from a statistical point of view, one would recommend that one embryologist per every 100 to 125 cycles done a year. If you take the example of Uganda with about 1,000 cycles a year, there are only 2 embryologists. So the gap is about 4 times as much. And then you have got the, what one would call the London Heathrow Airport syndrome, when an embryologist coming to support you from outside gives you a telephone call, Dr. James, I'm in the airport. So you tell him that, look, we will pick you up. But his next reply is, sorry, I'm actually stuck in London Heathrow Airport. I'm sure many gynecologists, many IVF doctors in Uganda and other parts of Africa have had their Heathrow moment. So it is on this basis that Merck has identified that is a key intervention point as part of the campaign to improve access to care. And we look at it from a different aspect, that the best will always try to deliver the best in anything that they do, recognizing that Merck is the oldest pharmaceutical company in the world and also the biggest pharmaceutical company in the world. So one can see and identify how it has managed to pick up this critical element, human resource element in training. The other aspect, which is also very exciting, is actually the course content itself. The degree to which Ivan and his team have been able to focus to the very need of the doctors, that when they finish the training after 3 months, they are able to hit the ground running. And not only that, I did work hard to design a research program whilst the training was going on, that the 2 embryologists were able to evaluate their own training process as that was going on, which will also inform and improve the other students coming through over the next 5 years. And it's a 5-year project every 3 months. Yes. So at the end of the 5-year project, we would expect to bump up about 40 to 50 embryologists within Africa. But each session will inform the other. So there is a multiplier effect in that regard. So it's not only training for the embryologists, but it is also training how to train the embryologists, how to learn better at each time. Thank you very much.
Thank you very, very much. I really like to thank everyone for your patience and being with us. And I think we have finished now the panel, and we can invite everyone to have nice dinner, and we can interact together now offline after we come down to our table. Thank you very, very much. Thank you.